Imagine looking around this room 70 years ago, 1 in 3 faces scarred by smallpox. A horrible disease, a pandemic that plagued humanity for 3,000 years. It disfigured, it disabled, and it nearly killed 30% of those infected. It tore through communities. It didn't care about politics or borders or poverty. It just spread. But then, in 1959, 66 years ago, a bold decision to get rid of smallpox. Countries, the World Health Organization, and partners all united on one mission: to vaccinate every person, to find every case, and to stop the virus in its tracks. And you know what? They did it. In 1980, smallpox became the first and so far only disease ever eradicated. It didn't just save lives, it saved generations. This success, it saved generations from illness, from stigma, and from poverty. Now, here's something you might not expect. At the beginning of the eradication campaign, it wasn't going so well. The first few years were slow and ineffective. But then, in 1967, a game changer, a needle. But not any needle, an innovation at the time called the bifurcated needle. This made smallpox vaccination quicker and better. And then, one of my favorite public health stories, another innovation a few years later. This time, a smallpox field officer who was not known to be, how shall I say it, the most energetic. Okay, let's be honest, he was kinda lazy. And yet, he was finding smallpox cases everywhere. He was outdoing even the most dedicated officers. So the national team got curious, and they went to investigate. What they found was both simple and brilliant. This man had created a photo book of smallpox, and he was handing it out in villages and in schools so that teachers and students could find new cases. He turned every village, every teacher, every child into a network of disease detectives. It worked. It worked so well that other countries adopted the photo book idea, and they used it to help them in their eradication campaigns. Even today, we use disease photo books to help communities recognize all types of conditions, from malnutrition to mpox. One man, one smart idea, a ripple of creativity and innovation that spread around the world. That's global health, where even small, scrappy ideas can turn into game changers. Now, I wasn't around at the time of the smallpox eradication campaign, but as an infectious disease epidemiologist working for the World Health Organization, I can tell you this: that type of success and impact, it's rare. It's hard, but it's the dream. And it also shows that when we work together, united against a common microscopic enemy, we can do extraordinary things. In more recent years, we've had our fair share of emerging and re-emerging diseases. COVID-19, the pandemic, turned our world upside down. Millions, especially in poorer communities, were left without care, without vaccines, without hope. And even though vaccines were made in record time, the reality is that only 0.3% of the 890 million doses available in the first 6 months went to low-income countries. 0.3%. Those who could pay got protected first. Governments around the world realized how unfair systems can be. And something rare happened. They met. They negotiated. And they agreed to a new global treaty, the Pandemic Agreement. The Pandemic Agreement is a global plan to do better next time, to be faster, to be smarter, and to be more fair. It puts this concept of fairness or equity at the heart of our thinking and action, as a goal, as a principle, and as an outcome. So, what does the Pandemic Agreement say? It calls for life-saving products like vaccines and medicines to be shared based on need, not wealth. It demands for innovation, manufacturing, and supply chains to be in every corner of the world. And it emphasizes coordination as one global community, not as isolated countries. This pandemic agreement won't fix everything, but it does show a promise that we can and will do better next time to keep people everywhere safe. So, here and now in the Asia-Pacific, I see incredible potential. By 2040, the Asia-Pacific region will make up more than half the world's economy. We already lead in innovation, in data, in manufacturing. So for someone like me, who spends every day thinking about the next health crisis, I think we should pick up the pandemic agreement and charge ahead in 3 ways. First, data. Imagine our surveillance systems across the Asia-Pacific connected, layering data from health and agriculture and climate and behavior, and using AI powered by people to detect outbreaks. Real-time alerts translate to rapid response. This is possible. When we trust and work with each other, we go further and faster. Second, innovation. Remember that smallpox field officer with the photo book? He taught us that people are at the center of creativity and innovation. The next solution can come from anywhere. A student here in Shanghai, a health worker in Hanoi, a software engineer in Sydney. Let us nurture our region's talent and make sure that the networks are ready to take great ideas and make them into real solutions before crises hit. Third, and perhaps my favorite, the Asia-Pacific's manufacturing muscle. The Asia-Pacific already produces a lot of what the world uses, from phones to vaccines, from medicines to electric cars. But when crises strike, supply chains snap, nationalism kicks in, and people get left behind. So, if we work together, surge our capacity, and have fair supply agreements, the Asia-Pacific region can become a global lifeline. Diagnostic tests from Korea, vaccines from Indonesia, medical equipment from China and Japan, all on planes within days. It won't be easy, but it is doable, and more importantly, it's necessary. So it's now up to us to take the pandemic agreement and turn it into reality. Scientists, leaders, innovators, students, citizens. Let's think about what we can do to bring that pandemic agreement to life. Let's make sure we use data optimally to help us protect our loved ones and others. Let's make sure that our innovations are emergency-proof. Let's review our supply chains so that They don't break during a crisis. In summary, if we look back in time, smallpox eradication proved that when we unite, we win. Looking at today, the pandemic agreement proves that unity is still possible. Looking ahead into the future, when the next pandemic strikes, and we all know it will, what will be our greatest defense? Is it a vaccine? Is it a medicine? These products are important, but I think we have to think bigger. Our unity, our lens on equity, and our collective action, because our greatest defense will always, always be us. Thank you.